I welcome you all to this week's Mansa Kunda with the Ministry of Health. The Mansa Kunda was initiated to promote proactive disclosure of information to the Gambian public. It is His Excellency, the President's vision to bridge the gap between the public and the government insofar as information is concerned. So the public can get accurate, timely, authentic information so they can make informed decisions, which promotes accountability and transparency, thereby consolidating our democracy. So the government can also get information about what the public is thinking. What is the public mood? What are the wishes of the public? What are their desires? What are their aspirations as well? What kind of country do they want? Therefore, the Mansa Kunda creates a feedback loop where we bring a sector minister and his entire team or her entire team to interface with the Gambian public and explain to the Gambian public how he is running his or her sector. But also the public can get the chance or the opportunity to ask relevant questions to the ministry insofar as the running of that sector is concerned. So they were a very important ministry. By the way, whenever we have a minister here, we say the ministry is important, because every ministry is important. But let me just go back, they said health is wealth. If a nation is not healthy, it is not productive. If it is not productive, it cannot build wealth. If it doesn't build wealth, its population cannot live in dignity. So this ministry is important. Today I welcome the Minister of Health, Honorable Mahamadou Lamin Samate, and his entire staff, who he will get the opportunity to introduce later, to this Mansa Kunda, to discuss with the Gambian people what he is doing in his sector, so we can hold him accountable for his actions or inactions. However, we have to, not me, the entire people here watching, also watching from home, express our displeasure in your ministry coming late to the Mansa Kunda. We are supposed to start at 8 o'clock. You came at 10 past 8. So I apologize on his behalf. I know it's a very busy season, particularly for the ministry. It's not his fault. He had wished to be here before 8, but he is here at 10 past 8. We accept it. And I'm apologizing. So you don't need to apologize to the minister. I've apologized on your behalf. Mbadingol mba tentula mba jela mba jala nying Mansa Kunda ni loku ngokono. Mansa Kunda mo programme dum yalon ko Minister of Information la sam mananjang president la miro la pour kaje ko banku dingol ni Mansa Kunda filo kana tare timma. So ngofe mi yalon ko banku dingol bato ela wasio ela miro anim fanang ilafta min nani la kolya kol Mansa Kunda sa kala mota. Bari fana Mansa Kunda salong banku dingol fana be mona kuto banku dingol fana salong Mansa Kunda be mona kuto monela miroti monela nganioti anim fana monela ferolde pour kajo banku dingol sitarano kairo kono la dinkiral fana itara dinkiral mi alon sitarano je suturo kono bari fani anim foroya kono odo nyim programme ngo wole fenam pour kajo ko minister o minister lo kumfla sinani banku dingol sikacha afa banku dingol ila secte ba borindi kan nyaadi le e mon do ko sifalella bari fana banku dingol se nyininka rol mi alon ko fana data ila secte bundala woto nying programme kumata bakele bidung nga mo kumari mbale soro jam yalon ko ministre kumari mbalo ministre yalon ate mara jata kende ya bundala mi ngalon ko jata kende kumata bake ba nim mo jato man kende te fengo fen kenola te do ko kenola ite karanola hani karo fengo minka sabatendi wolon na police ol ni solaro fo jato se kende ya pour karo sabati woto ministre mi an ka kumata bake do milbe jambi kana ka mabe jambi tentulambe jala mbal kontona bake familbe sirinjang kabona cabinet ministerial ifele sirinjambi na head of the civil service, deputy director at the Department of Press, na ambassador mi alon ko lebi jambi kabo China kata fotoki ane UN ibe jambi na senior government officials so fana bibi jambi ane mo mi alon ko lebi jambi ane media journalist on bal jala ni Mansa Kunda honorable minister media in la timobe metantola mbejala mbeni mbarala bi katabe kumala bake mo ke de landalal si Mansa Kunda mi ngam mom lañ am semaine bi di dalal ki nga xam ne mooy ministre honorable Amadou Samate mooy ministre mi nga xam moom lañ dénka wérgu yaram gi moo fi ñëw tey teewu fii ak ñi nga xam ne ñoom la moo liggéeyal ñu waxtaan ak askan bi wax ñu li nga xam ne moom la nekk di liggéey si jawriñ bi nga xam ne moom lañ ko jox mooy ministry of health programme bi nag ñu ngi ko jaglal askan bi président dafa wane bëgg réeroo am diggante askan bi ak nguur gi ba lépp lu nga xam ne askan ba nga ko jànkuwanteel li nga xam ne mooy seen pas-pas li nga xam ne moom mooy seen bëgg-bëgg ak seen xalaat pour nguur gi yëg ko waaye tamit bëgg na tamit li nga xam ne loola nguur gi di liggéey seen liggéey bi seen programme si initiative si ak li nga xam ne moom la ñoo liggéey seen policy si bëgg na askan bi yëg ko moo tax programme bi ñu jagleel ko ñaari semaine bu nekk ñu si benn ministre benn jawrin ak ñi nga xam ne ñoom la àndal ñi moo liggéeyal ñoo toog fi jàkkaarloog askan bi mu wax ñu nu moo doxaleeg sectoom waaye tamit askan bi laaj ko tamit li nga xam ne moom lañ ko bëgg a laaj mu wax ñu ko te nag am nañ gan gu màgga parce que ñëpp xam ne wér-gu-yaram lu am solo la te ku feebar doo mun a def dara kon wér-gu-yaram lu am solo la moo tax ñu isi ministre Amadou Samate mu ñoo jàkkaarloo askan bi nuyu ñëpp ñi nga xam ne ñoo fi teew tey gis nañ honorable ministre yi fi toog tey ñi nga xam ne mooy minister of public service mu fi minister of agriculture ministre bi nga xam ne moom lañ dénka jàng ak jàngale bi tam mu fi ñu ngi koy honorable Habibatu Dramé ki nga xam ne moo jiite civil service par mu fi ak deputy chief of staff mu fi director of press deputy ba mu fi senior government official si am fi ak suñ ambassadeur yi nga xam ne ñoo fi nekka ñi nga xam ne ki jógee Turkey China ak UN ak ñeneen ñi nga xam ne tey ñu ngi fi teewu tey kon waxtaan gi tey dina neex dina xumba waaw balaa ñoo sori nag lu ñëwee def mooy Mansa Kunda bu passé season 1 dañu bàyyi ministre mu wax ñaari fukki minute waa ñu sectom bi waaye ñu ne wéy di gis bokku si su ñëwee wax 20 bi dañu ne politiciens yi wax rek dañ leen a woon vidéo buy won nit ñi li nga xam ne moom la liggéey si sectom su paree ñu jàkkaarloo askan bi laaj ko nga ma lañ ko bëgg a laaj honorable minister will play the documentary for 20 minutes then we'll open the floor for Q&A jërëjëf.
A child's first breath is one of life's most powerful moments. For generations, many Gambian families traveled long distances in search of medical care, especially during critical moments like childbirth.
All this investment is not for any other reason, it's to touch directly the lives of the Gambian people, to make sure that the suffering they are going through to see a nurse, to see a medical doctor, is actually eased.
And for sustainability, for independence in the way we do things, for ensuring quality, we have to get our own. That is what warranted the construction of this, under the instruction, the leadership, and the guidance of His Excellency, the President himself. So that's why we are here today. By the time this is completed, inshallah, it will be a state-of-the-art infrastructure that will go a long way in ensuring the well-being, inshallah, of the people of this country.
I think the government has a very good foresight in ensuring sustainability in the health sector. And the best way to do that is actually to train people in country.
Our investments are very strategic in terms of easing the burden of our citizens.
Today, across the country, healthcare services are moving closer to the communities that need them most.
Karamodo Ninsasara, Jaisano Janatarial, Yamur Karamo, or Jenin Casoro, Ekanajan Era Swokon, Waldo Boga, Joran or Membe Sambal Kokenava, Esi Swokon, Asakeno Tulufula Tulisava, Bokara Karamo, Hona Naragam Baran, or Bello Plano Sorora, a question.
Janilo Plano Kana, Benyamin no, and be Benyamin Mankelia, Manyatu Tabas or the Bayotumontulkata Karantabale. Ngata boro nyini je talata o talata sinya kileng nin talata o sitan ka funtola sitin nga ramuta ni nga ramuta ngata hani moto nata moto nyinga mo konto menta ni o mo sotota hani te be sasari te be wolungo bayla le bo talata o bayla le sai be talata ko tele batula
ar janni moto bina wo wici don tema ne muso kono ya ma waranto mo sasat a ka bata bak parce que taranko tem bulu jantu moto te jang masima te jang hani sareto luotumo sareto ate jang.
From regional hospitals to newly established health centers, the expansion of healthcare services is bringing quality care closer to the people.
Dumonintingo mo manka kolleke karda mo sasata sina ina moto to ya samba Aita boronyini, aita loptano kena ba wulu, me ya dandanga sija be laje fo fanoek. Par sa mbiri ne monata, mbe Mansa Talla la ne molas. Nata mur ko ta kembula tan loptano kon. Sa mbiri ngani loptano ni soto. Ikatara suwo kono doron tingo yela moma. Ya kolke loptano de ko na mo sasa ta ina ne nakam. Aita wulu, na wulu te ya na dingo tular la na gaita suwo kono. Yete ila fo la mula wulu te fo na ya le tara jang fo somo. Under the
leadership of His Excellency, President Adama Barrow, the government of the Gambia has prioritized strengthening the national health system. Through sustained investments in infrastructure, the training of health professionals, and the expansion of services, the Ministry of Health continues to improve access to quality healthcare across the country.
The immediate vision of government is to have kidney transplant in the country, to have open heart surgery in the country. And that's going to be possible very soon because the German government, in partnership with the Gambia government, as part of the Gambia government counterpart financing, are going to build a multi-purpose surgical center in Farato. Very soon. The process is ongoing, and we will launch the tender very, very, very soon. So the impact will be huge. And once we are done with 30 to 40% of the current work in Farato, you will see a huge U-turn. Instead of Gambians going out for treatment, you will see people outside the sub-region coming to Gambia for medical treatment. And that's very soon.
Strategic planning plays a critical role in guiding national healthcare development. Through policy formulation, monitoring, and digital innovation, the ministry ensures that health programs are effectively implemented and continuously improved.
Learning from COVID-19 and maybe a bit earlier, the government of the Gambia, through the Ministry of Health, has also instituted regional rapid response teams in all the regions. So we have core sets of people who can respond to outbreaks at the regional level. So these things are just things related to the human capacity. But also, if we go a little bit looking at the systems we use, we've moved to a good extent away from paper-based systems, electronic systems, both for aggregate data, for case-based or individual data, and laboratory data.
Delivering quality healthcare requires skilled professionals, well-equipped facilities, and efficient systems that support patients at every level of care. At the same time, preventing disease and protecting communities remain central to the country's public health strategy.
There's a lot of improvement regarding the functionality of the hospital. For example, now we have our own pediatric surgeon. Until now, most of the pediatric surgery cases will travel outside the Gambia. And then, that's where they get the care. But now, we do them all here, almost all of them. So the specialization has really helped. Now you have, for example, the urology now. They do TOP, they do very advanced surgeries. You have endoscopy. Those who used to go to Senegal, now they can do it here. So this, what it does is, because, for example, if you have to send somebody to Senegal, their ticket, the family they go with, if they go there, they have to start the test all over again. It's not conducive at all, and it's very expensive. But if you have to do it in Gambia, it's less expensive and less troubling to the patient, and you have a better outcome.
Across regional hospitals, such as Basse District Hospital, dedicated healthcare workers provide critical services to hundreds of patients every day.
So, beginning with, let's talk about the public health unit. We have the surveillance. So then surveillance was not very advanced. So disease surveillance was just limited to certain areas. But now with the coming of we've trained more surveillance officers. So we have the number, the human resources, more public health officers. We're able to do a surveillance report of the entire region. Whatever is happening here, we have an update of what is going on.
Over the years, if you look at the government budget, you see that the number of health workers being absorbed is increasing gradually, year by year. And this also enabled the Ministry of Health to be able to deploy health workers more and more into more and more remote areas. So if you look at, for example, the number of public health officers we have, it has more than tripled in the last few years. And because of that, the number of health facilities offering immunization services that have cold chain systems are now over 113 of them.
At the Edward Francis Small Teaching Hospital, specialized services continue to expand, strengthening the country's capacity to manage complex medical cases. Across regional hospitals, such as Basse District Hospital, dedicated healthcare workers provide critical services to hundreds of patients every day.
So Basse District Hospital is the only district hospital of the Upper River region, and this is also one of the farthest region in the country. And it's where we offer a lot of services. We have a catchment area of more than 97,000. And also we see surrounding villages around the Senegal and the border. We don't only see Gambians, we also see non-Gambians. We offer a broad range of services, ranging from obstetric and gynecology services, medical, surgery, pediatrics services. We also art unit, we also have an art unit, also the art clinic. We also see ENT, those that we can manage, then we manage. Those that we cannot manage, then we send to the next level. Because of it's the nerve center, I call it, of the Upper River region, we have a lot of referrals that come in here because it's pleased that we have a theater, that cases that can be managed in the periphery, that case that needs surgery, that they have to come to the Basse District Hospital to get their definitive management.
Across rural communities, new health centers are bringing essential services closer to families who once traveled long distances to seek care.
Wotumo nintu musomuta nyantari fada banyul ka kundol wasangata dol bu kafuta dol ka wulule dingol ye bang o dol fanay wulu ye dingol tukom be mu ko ya ko
1996 la sey fi ci sama jox waye lima sey yep ci ciono la nek ngir lan man buma ëmbé kunta yalla fajoji buma démé lab esso la démé lab suma wasin kunta yalla wasine té lol yep ciono la lima dox di wasin yep musuma dugg moto ndax moto yi amut fi benn moto moo fi ne ole yar la mun naa jóg fekk sama taami moto jotut mun naa jóg fekk suma doom feebarut sareet lañ maa takkal sareet bi mun naa nekk sareeti mbaam mun naa nekk sareeti fas bala maay àgg mun naa loru wala suma doom mun naa loru ndax dal na ma benn yoon maa suma biir bi di métti ma war a dem hôpital pour uti garab waaye coono bi ma jànkuwaate tax na bi ma demee biir boobu noonu fekk maa ngi nekk 4 months dafa mujjoon tuur noonu laa tëddee Kuntaya am fa 1 week ñu discharge ma ñëw di naan garab ba bi ma amaatee loolu yëpp coono la woon fii.
ndungu so tawi an ko gerte ndemɗa ko so yeehi ha a yeehi gerte de mbawata dañde haalis so tawi noon an a faawa e nder ndungu ete ala haalis a wawata ñawdude ɓiɗɗo ma a wawata ñawdo an hoorema ɗon ko miijotoɗa ko ñamɗa surtout noon so tawi aɗa ɗaɓa ko ñamɗa ha so tawi pawle ari e dow ɓiɗɗo ma walla ari e dow ma ɗum ɓeyrima addan caɗele ɗum wonino ɗo hanki
la time boobu affaire yi aussi ni moo ñu daanaka moo doon tax ñu doon rifaat nit ñi parce que li si des yëpp am na fi fu mu toll nii développement moom yokku na léegi moo gën a baax ni bu njëkkoon waaw léegi moom dégg-dégg moo gën a baax ni bu njëkkoon bi loolu amee nag dañ la daan jël yóbbu la Banjul léegi lu bari suñ théâtre bi mu ngee dox am nañ docteur te time boobu amuñoon docteur waaw léegi am nañ docteur am nañ yëpp loo bëgg a si wàllu faj am na ay sow fu mu toll nii.
The numbers have increased because especially with the obstetric service, like I said, sometimes we receive some patients up to from Badibi area. Though it's a bit far from here, but on certain occasions we do receive patients from Badibi. So and then also from the neighboring country, Senegal, people come here for service. So the numbers have increased and it's increasing every day. Even if you go to the ophthalmology, the ophthalmic services, most of our patients are coming from Senegal. So this upgradement of the facility has increased the age patient income. So we are receiving more patients now than before.
So the coming of this facility has been a big relief for the people of Jokado, definitely, because I understand from our data of last year, we had a minimum of close to 8,000 patients just at the OPD. So, and deliveries here, our average is 25 to 30 a month. That excludes the antenatal care. Last year, our antenatal service was around 4,000 for the year, just antenatal services that we do. So we have 5 outreach areas and 1 base currently. So we go to trek in all these places. So before this facility, Kuntaya was taking care of all of this, and most of them will go and meet them. So you can imagine before this facility, there was a big struggle. But the coming of this facility definitely have been a big relief for the people.
When this new facility was upgraded, it brought the healthcare services to the doorstep of the people living in the community here. Because just as what the committee members said, before, the women used to deliver at the home delivery. They used to conduct home deliveries or on their way to the hospital. But now, with the help of this upgraded facility or the new facility, now majority of the deliveries used to happen here. We conduct them here with no complications or delay.
It's an exciting day today here at Jali Health Center. We just delivered a bouncing baby boy. Both mother and child are in good conditions and both healthy. There were no complications, and this is why we do this, the job we do and the services we deliver.
Moments like these highlight the importance of expanding healthcare services to every corner of the country. For families in communities like Kiang Jali, having a health facility close to home can mean the difference between uncertainty and hope.
Le plano nyimbira sodra ay nyalta men dinna o nyalta ni warta bak kadum folo ni atra kono le dimidron ini mboro sina le plano re borota ni atra mol mi alon kutingola yama ye le men no soli ye kumo fo don ini borota wala hani makmo no soli ni isi soni sanya moro samana ay na fo le plano to jang ya ja si wulu bulu jang nama wulu ne bulu jang ya samba jara soma okay ana boro ko renje isa yako dinni woni fana ni dinni woni problème wala soda sasat le bang ini mboro sina nya moto nano ine na fo je na sam okay birwol beketa way nyaalo tal men dina warta
ngalo nyaame ni leptano be karamu e shato to aka karamu ndo dinul mako ila karamu katade bay ni mina ni na leptano han yem mol tara sharing e ka opportunity di lollale yetol trido ye muru yete la karamu continue ba wotu monu ni tada ni karamu ndo dinno ni shasha ma wala otilo mumo be aka fola go shakata damen do aka tilo mumo kejele wolu mumo